AlohaCare, having served communities for 30 years, is remarkable. How they have sustained their governance and their partnership with community health centers shows their commitment to the community, their commitment to investing in access to quality health care for all communities.
And it's really been 30 years since AlohaCare was launched. That's truly amazing. I remember those days, and it was a real challenge to launch the plan. It's just so wonderful to see, you go back and look at their master long-range plan, and we've done almost everything. So it's very close to my heart.
If we go back to the earliest days, there was a healthcare was changing, managed care was becoming a reality in Hawaii, and I think many people were concerned about the trajectory of healthcare for Medicaid patients in particular in Hawaii, and a desire to take control, have sovereignty over that process. And so I really think AlohaCare represents the highest aspirations of all of our communities towards that sense of sovereignty and control over something that's so important in their daily life.
AlohaCare was one of the success stories and is still one of the few community health center organized health plans that still exist today.
I remember going out to Waianae when they just had almost like mobile units out there before they have built out to an impressive site nowadays, but it wasn't like that back in 1993, 1994.
In the early days of AlohaCare, the motivation of the health centers was to respond to a major paradigm shift in the country, which is to take Medicaid, which used to be a fee-for-service model in which health centers were reimbursed based on their cost, and to shift that to a managed care model, generally in the image of commercial health insurance.
So we were busy just getting people who could help us. And it was like a miracle. I mean, a lot of what's happened at AlohaCare is like a miracle. We found these people who were interested in us, who wanted to come to work for us, who had the skills and the background and the experience and the knowledge that provided exactly what we need.
It was just an exciting time because it was the providers that we were looking for, making sure that they understood what the relationship was going to be and that it was going to be more direct, provider directed, and that it wouldn't be a lot of administrative rules placed on the providers by the health plan. That, you know, we wanted to get their feedback on how things should be working, and we did that.
I've got to say that one of the greatest pleasures of the job is the diverse community that we served.
My hope would be that AlohaCare and the people associated with AlohaCare can be that voice for those people who may be voiceless and help those people be able to speak their needs and their hopes and their desires.
It's really about helping Hawaiians, helping the Polynesian people, helping the people of Hawaii.
I would tell a member or provider, you know, AlohaCare is in Hawaii. You're going to get this close relationship. We show it with how we treat our members and how we work with our providers. AlohaCare is great with that because our people are from the community. We work in the community, we live in the community, we grew up in the community. Our families are in the community. We have live people calling them, outreaching to them, to the members and providers, just trying to help them as much as we can.
Building on the relationships that our founders created, AlohaCare has nurtured over 300 agreements with community-based organizations, and they're everything from churches to the food bank to legal services organizations, maternal health. It runs the gamut. In addition to that, our healthcare provider network is over 7,000 strong.
We wear so many hats as a community health worker, day to day, reaching out to our members, making sure that they have what they need, housing, food, getting the medical care access. A lot of what I do too is going out to the community health center, Hamakua Kohala Health, helping out members over there, and doing community events and just reaching out to other organizations, agencies, and just making those wholesome community connections. And that means a lot to me.
We're a small enough place that what you do, inevitably you're helping my friend or my auntie, my cousin. I mean, we truly are all in it together.
It's the community. We're here to serve the community, including or especially the most vulnerable amongst us.
I love reaching out to the community. I love going and seeing our members in their home, helping them with their needs, helping them get the care that they need, the help that they need, just resources out there, other programs in the community that we can connect them to.
It's really important for all of our health workers, whether they're social workers, nurses, community health workers, even the care navigators that work with our team. I think the more time they spend at AlohaCare and the more knowledge they gain, all help to, improve the outcomes of our members and help them to deal with their different variety of health conditions.
We also help our members to apply for any assistance that's available, like maybe food stamps or housing. We also help them with Social Security.
Having people local and having the decision makers local is that we know what to do and how to do it. And so we've had multiple events that have taken place over the years where we've had to react and make sure that we're dealing with the situation appropriately and making sure that the providers and our members are taken care of.
I think the beauty of AlohaCare is they've been the most flexible in being aware of the inequities in the system and making adjustments where we're still looking at value-based care, but we're leveling the playing field. And so really thank AlohaCare for that.
We are proud to be one of the first health plans ever that have introduced Native Hawaiian healing services as a covered benefit. We are also extremely proud that others are following in our footsteps and creating that opportunity for many, many local people and Native Hawaiian peoples who really embrace Native Hawaiian healing side by side with traditional medicine. And again, it's just an indication of our focus on whole person care.
I think trust is so fundamental when you're working with socioeconomically advantaged communities, especially indigenous community, host communities, where there's a very good reason not to trust. But we work and we're intentional, both AlohaCare and the Waianae Comp, to ensure that what we do is trustworthy and transparent to the communities we serve.
When there are going to be decisions made about the Medicaid population, AlohaCare is valued as one of the key contributors.
I think my message to the staff, for being a part of AlohaCare's 30-year journey is just a very big mahalo.
Huge mahalo to the staff of AlohaCare who come in and make this possible. Their kindness, the way they approach their work every day, the integrity with which they do that, all of them.
Our engagement has increased with members. They're more willing to engage in their healthcare journey because we've prioritized what's important to community. We think of our members not as individuals, but as part of a community or part of a ohana. Even if they're alone, even when they don't have all of the resources of a traditional family structure, we create those structures for them so that we're delivering individual care, but we deliver on that commitment to moving community health forward.
That's why we exist, so that people can get to where they need to go. Whether that's educational pursuit, which my parents instilled in me, whether that's whatever job, whatever career, whatever, you want to have a family, you want to be able to live and be a part of the community here. I think that's just, our role is to enable people to live that life healthfully.
Well, now AlohaCare has come to a point to where, one, we can increase the diversity of our patient population, the selection is different, and two, we have the tools to make sure that we can strive to improve the quality of life and the outcomes of the patients we serve. And that accounts for the improvement, significant improvement in the results that we have.
Healthcare in our country has been so profit motivated. It has been relying on specialists and tests and drugs and all kinds of things and ways to increase the cost of providing medical care. But I think that where we need to be going, and I believe we are, is understanding what affects people's health and getting at the root causes for that. Getting at the poverty, getting at the housing, getting at the transportation and the prejudice and the education levels and all of the things that contribute to how people's health turns out.
For looking at that 30-year anniversary and 30 years going forward, it's really a sea and a flow of who comes before and who's here now and who will be here in the future. And it's just really important to remember the values that we get from, sort of from our forefathers, so to speak.
I'm hoping that we're not having to help so many people with housing. I'm hoping that the crisis is, not as bad, but that we're still here and that we're doing the work that needs to be done, that we're reaching out to our communities. And we can say, yes, we have more access, and yes, it's easy for you to see a doctor and, getting things done right away.
I think the sky is the limit. I think we're only now just beginning to see the potential of our families that we serve taking full agency and embracing sovereignty over their health care.
I would love to see more Hawaiian and Samoan and Tongan and Micronesian young people with the potential rise up to become the healthcare professionals and caregivers for their own peoples. And that is possible when we speak of the sky is the limit.
My hope is that we will continue to move in the direction of total access to care without a cost to individuals to achieve that, right? And so that may mean that AlohaCare is not here anymore. But that's, from my perspective, sad in some ways, but it's okay if everyone has access to high quality care at no cost. Because that's what we want.
We know increasingly how interconnected all this is, that eating good food is also about supporting our farmers and the farmers who are taking care of the land here. So those relationships, again, we have to think outside of our narrow lane of doctors and nurses and doctor's office and think broadly about healthy, vibrant communities for all of us here in Hawaii.
When I think of AlohaCare, the future AlohaCare, I see a company that is the driver and a leader in the space of health equity that is setting the standards for what it means to really address healthcare and social disparities, and to do that without creating stigma, to normalize it, and to bring others along. Aloha is the difference.